Hello Health IQ family, welcome back. As October is Breast Cancer Awareness Month, and today we're diving into an important topic, breast cancer. In this video, we'll explore in detail what breast cancer is, the common symptoms, causes, treatment options, and what you need to know to raise awareness and stay informed. So, let's start by knowing what breast cancer is. Breast cancer is a disease where abnormal breast cells grow uncontrollably, eventually forming tumors. These tumors can start in the milk ducts or lobules, the milk-producing parts of the breast. In its early stages, known as in situ breast cancer, it isn't life-threatening. However, when the cancer spreads to nearby breast tissue or other organs, known as metastasis, it can become deadly if left untreated. Moreover, there are a lot of global impacts of breast cancer. According to World Health Organization, WHO, statistics, breast cancer caused 670,000 deaths globally in 2022, making it one of the leading causes of cancer-related deaths worldwide. In fact, breast cancer is the most common cancer among women in 157 out of 185 countries, meaning it affects women in every corner of the world. Though it primarily affects women, it can also occur in men. About 0.5% of breast cancer cases are male. So let's talk about breast cancer symptoms and why early detection is crucial. Results show that most individuals won't experience noticeable symptoms during the early stages of breast cancer. This makes regular checks to help early detection critical to preventing the spread of cancer cells to other parts of the body is very important, metastasis. However, breast cancer can present with a range of symptoms as it becomes more advanced. Here are some common signs to be aware of. 1. Breast lump or thickening. Often painless, this is one of the most common symptoms. 2. Change in size or shape. A noticeable alteration in the breast's appearance. 3. Skin changes. Dimpling, redness, or a pitted appearance, like the skin of an orange. 4. Nipple changes. Alterations in the nipple or the surrounding skin, areola, including inversion or abnormal discharge. 5. Abnormal nipple fluid. Bloody or unusual discharge from the nipple. Even though most breast lumps are not cancerous, it's essential to consult a healthcare provider if you notice any unusual changes. Cancerous lumps are more likely to be treated successfully when detected early, before spreading to nearby lymph nodes. Breast cancer can spread to other parts of the body, most commonly the lymph nodes under the arm, even if the affected lymph nodes aren't palpable. Over time, cancer cells may reach organs such as the lungs, liver, brain, or bones, leading to symptoms like bone pain or headaches. This spread makes treatment more complex and highlights the importance of early screening and diagnosis. If you notice any of these symptoms, it's vital to seek medical attention for a proper diagnosis and early intervention. Now let's talk about the common risk factors for breast cancer. Causes of breast cancer. Research has identified several factors that increase the risk of developing breast cancer. Here are some of the most significant. 1. Age. The risk of breast cancer increases with age and is most prevalent in postmenopausal women. 2 is family history. Having a first-degree relative, mother, sister, or daughter, with breast cancer significantly increases the risk. 3. Genetics. Inherited genetic mutations, particularly in the BRCA1 and BRCA2 genes, account for up to 15% of breast cancer cases. Obesity. Being obese, especially after menopause, increases the likelihood of breast cancer due to higher estrogen levels from excess fat tissue. Tobacco use. Smoking raises the risk, especially when initiated at a younger age and continued over time. Alcohol consumption. Alcohol can damage DNA and interfere with nutrient absorption, such as folate, increasing breast cancer risk. Reproductive history. Women who have never given birth, nulliparity, face a higher risk compared to those who have had multiple pregnancies. Radiation exposure. Previous exposure to radiation therapy, particularly to the chest area, heightens the risk of developing breast cancer. Postmenopausal hormone therapy, HRT. Women using HRT for menopause symptoms have an elevated risk of breast cancer. Physical inactivity. A sedentary lifestyle can contribute to a higher risk of breast cancer. While these risk factors have been well documented, the precise mechanisms that trigger the transformation of normal breast cells into cancerous ones remain unclear. Regular screenings, lifestyle changes, and genetic counseling for high-risk individuals are essential preventive measures. Another key thing to know is to understand breast cancer treatment. When it comes to treating breast cancer, the approach depends on the type of cancer and how far it has spread. For instance, if the cancer has reached the lymph nodes or other parts of the body, doctors will tailor their treatments accordingly. Understanding the treatment options for breast cancer is important because this helps to minimize the risk of cancer coming back. Doctors often combine different treatments. Here's a breakdown of the main options. Surgery. This involves removing the cancerous tissue. Depending on the situation, a doctor might perform lumpectomy, removing just the tumor and some surrounding tissue. Mastectomy. Removing the entire breast. Sometimes, lymph nodes are also removed to check if the cancer has spread. Radiation therapy. This helps target any leftover cancer cells in the breast or lymph nodes, reducing the risk of recurrence. It's especially important after surgery to ensure no microscopic cancers remain. Another option is by medications. Hormonal therapies. For cancers that are hormone receptor positive, treatments like tamoxifen can be taken for 5 to 10 years to significantly lower the chance of recurrence. Chemotherapy. Used for aggressive cancers, especially those that are hormone receptor negative. Today's chemotherapy is highly effective and can usually be administered on an outpatient basis. Targeted therapies. If the cancer is HER2 positive, targeted treatments like trastuzumab can be used alongside chemotherapy to effectively kill cancer cells. Next, let's talk about why early treatment is important. Starting treatment early and completing it is crucial for the best outcomes. If you only get partial treatment, the chances of a positive result decrease significantly. A word on side effects. While hormone therapies can cause menopausal symptoms, most patients tolerate them well. Chemotherapy is also generally well managed, with outpatient care being the norm. Radiation's role in treatment. Radiation is vital for both early and advanced breast cancers. It can help prevent the need for a mastectomy and reduce recurrence risk even after surgery. For those with advanced cancer, it can improve survival rates. In summary, effective treatment for breast cancer involves a comprehensive approach tailored to each individual's needs. By understanding the options and their importance, we can empower ourselves and others in the fight against breast cancer. Empowering women against breast cancer. Thank you for joining us today in our exploration of breast cancer treatment and awareness. If you or someone you know has been diagnosed with breast cancer, remember that you are not alone. Here are some key takeaways and advice. Stay informed. Knowledge is power. Educate yourself about your specific type of breast cancer and the available treatment options. Don't hesitate to ask your healthcare team questions. They're there to help you navigate your journey. Regular breast checks. Women of all ages should prioritize regular breast examinations. Performing monthly self-exams and scheduling annual mammograms can lead to early detection, which is crucial for successful treatment. If you notice any changes, such as lumps or unusual discharge, consult your doctor immediately. Embrace support. Lean on family, friends, and support groups. Sharing your experience with others can provide emotional relief and helpful insights. Remember, reaching out for support is a sign of strength. Lifestyle choices. Maintaining a healthy lifestyle can aid your treatment and recovery. Eating a balanced diet rich in fruits, vegetables, and whole grains, along with regular exercise, can improve your overall well-being. Treatment options. If diagnosed, discuss all treatment options with your doctor. From surgery and radiation to hormonal therapies and chemotherapy, understanding the treatments available to you will help you make informed decisions. Self-care matters. Make time for activities that bring you joy and relaxation, whether it's reading, yoga, or spending time with loved ones. Self-care is essential during treatment. Final thoughts. Breast cancer may be daunting, but early detection and comprehensive treatment can lead to positive outcomes. Let's continue to raise awareness, support each other, and advocate for regular breast health checks. Thank you for watching. Don't forget to like, share, and subscribe for more health tips and information. Together, we can make a difference in the fight against breast cancer. Stay healthy and see you in our next video.